Cancer Breakthrough 2025, treatments your doctor doesn't know about yet. What if I told you that the cancer treatment landscape has been completely revolutionized in just the past 12 months? What if the deadliest blood cancers that doctors called hopeless just 2 years ago are now being cured with breakthrough therapies that sound like science fiction? The medical establishment is moving slower than the research. While you're being told to manage expectations and follow decades-old protocols, revolutionary treatments are saving lives in clinical trials around the world. And most doctors haven't even heard of them yet. For decades, cancer treatment followed the same brutal playbook: cut, poison, burn, surgery, chemotherapy, radiation. But in 2025, we're witnessing the dawn of precision medicine that targets cancer cells like guided missiles while leaving healthy tissue untouched. The 2024 American Society of Hematology meeting changed everything. Results were announced that should have made international headlines. But they didn't. Because breakthrough medical research takes years to filter down to your local oncologist. Here's what they don't want you to know. CAR T-cell therapy is achieving 85% remission rates in blood cancers previously considered terminal. That's not treatment. That's not management. That's cure-level results. But it gets better. Scientists are now creating personalized mRNA vaccines that train your specific immune system to recognize and destroy your specific cancer cells. Over 200 patients across multiple countries are in trials right now. Expected completion, 2027. This isn't hope. This is happening. But here's the most shocking breakthrough of all. NHS England just rolled out liquid biopsies, simple blood tests that can detect cancer mutations and match you with life-extending therapies in days, not months. No more waiting for tissue biopsies. No more guessing which treatment might work. No more precious time lost. A blood draw can now tell doctors exactly which targeted therapy will save your life. So why isn't your doctor offering these options? Because medical education is designed around established protocols, not cutting-edge research. The same system that took decades to accept that stomach ulcers are caused by bacteria, not stress. The same system that resisted hand-washing in hospitals because it challenged medical authority. Innovation happens in research hospitals and clinical trials first. It takes years, sometimes decades, to reach standard care. But you don't have to wait. Here's what you need to know about accessing these breakthrough treatments right now. Breakthrough #1 CAR T-cell therapy. This treatment literally reprograms your immune system's T-cells to hunt cancer like guided missiles. Your own immune cells are extracted, genetically modified to recognize cancer markers, then infused back into your body. Recent advances include allogeneic CAR T-cells, off-the-shelf versions that don't require your specific cells. This means immediate access instead of weeks of preparation. If you or a loved one has blood cancer, ask your oncologist about CAR T-cell therapy eligibility today. Breakthrough #2, liquid biopsy testing. This simple blood test can detect circulating tumor DNA and match you with targeted therapies. The NHS study showed patients receiving matched therapies lived significantly longer with better quality of life. Major cancer centers are now offering liquid biopsies, but many patients don't know to ask. Request liquid biopsy testing at your next oncology appointment. Breakthrough #3, personalized mRNA cancer vaccines. Using the same technology that created COVID vaccines, scientists are now creating custom vaccines for your specific cancer. They analyze your tumor's genetic fingerprint and create a vaccine that trains your immune system to recognize those exact mutations. Early results show dramatically reduced recurrence rates. Contact major cancer centers about mRNA vaccine trials in your cancer type. Breakthrough #4, AI-driven precision medicine. Artificial intelligence is now analyzing thousands of genetic mutations to predict which treatments will work for you specifically. This isn't guesswork. It's precision medicine powered by machine learning. AI systems can identify rare cancer subtypes and match them with targeted therapies that traditional methods miss. Ask your oncologist about AI-assisted treatment planning. But here's what you must understand. You have to be your own advocate. The squeaky wheel gets the oil in cancer treatment. Doctors are overwhelmed and often stick to familiar protocols. You need to ask about these breakthrough treatments. You need to demand access to clinical trials. You need to seek second opinions at major cancer centers. Your life depends on being informed and persistent. Here's your action plan. First, Research clinical trials at clinicaltrials.gov for your specific cancer type. Second, contact major cancer centers like MD Anderson, Sloan Kettering, or Johns Hopkins about breakthrough treatment access. Third, ask about liquid biopsy testing and genetic tumor profiling. Fourth, request CAR T-cell therapy evaluation if you have blood cancer. Fifth, inquire about mRNA vaccine trials. Remember, these aren't experimental treatments anymore. They're proven therapies that are simply new to standard practice. The difference between getting these treatments and waiting for them to become standard of care could be years of your life. Don't let outdated medical timelines decide your fate. We're witnessing the transformation of cancer from a death sentence to a manageable condition, but only for those who know these options exist. If this information could save your life or the life of someone you love, share this video immediately. Subscribe for weekly updates on medical breakthroughs your doctor hasn't heard of yet. This is ThriveLoop, where we bring you tomorrow's medicine today.